Okay. So I'm going to introduce our patient speaker today. I met Mr. Barnosky, John Barnosky. I actually met him coming into the group several years ago while he was off treatment and in surveillance. But he is, just, I can't say enough about how motivating he is, what a positive person he is, how well he wants to just talk about his experience, his cancer experience with patients, and I'm glad that he's here today to speak to all of you. So.
I don't need any slides.
Okay.
What a flattering portrait. I hope we've saved the best for last. I'm really happy to be here. In fact, I'm happy to be anywhere. When you hear my story, it was rather daunting from the outset. And I should tell you a little about me. I'm 64 years old. I'm a retired drug rep. And I spent literal decades waiting in doctor's offices, hanging out in sample closets. I believe I calculated I sold 25 products in 22 therapeutic areas, but never in oncology. So I had no idea what to expect. We've seen all the slides and the wonderful science and all that, but this is where the rubber meets the road. And when you take all this, and I've had many, many good physicians in my travels, a lot of the really good ones would say, when all else fails, look at the patient. And the data is all very nice, but when you really see the impact that it has on the patients and what you can do to improve and prolong life, I certainly think that's worth a look. We saw the slides with them. Well, you could sit in a physician's exam office in your primary care's office, and on the wall there's a poster that says the ABCDs of melanoma, and there's an older guy with a black lesion on his nose. That's not how my story started. It was rather through serendipity. It was the holidays of 2012. I was on the bed watching TV, and I went to prop my head up on my elbow, and I felt a lump. And I went, whoa, what is this? My wife, Joanne, is sitting back here. She was my rock. We'll introduce her in a moment, but I said, well, now what do we do? She said, well, let's make an appointment with an ENT. We made an appointment with an ENT who came in and did a needle biopsy. About a week later, it came back suspicious for melanoma. He said, we got to act on this. So Christmas Eve, I was in the hospital having a core biopsy done, which in January of 2013 came back positive for melanoma. He spoke to my wife and he said, we've got a tiger by the tail. You've got to move on this. Well, I didn't start out at CINJ, I have to tell you, because I live kind of south of here. And when I first met the surgical oncologist, I had every scan known to man, you name it, I had it. He came into the exam room and he looked at me and he said, I've seen your scans and they're not good. There's nothing I can do for you. Well, that's the last thing you want to hear, certainly. He said, I would suggest that you would consider any clinical trials here. Well, I said, okay, well, let's see what's what. We went to see the medical oncologist. And because I had prostate cancer about 4 years earlier, I was precluded from any type of clinical trial. Well, if you saw my scans, I lit up like a Christmas tree. I mean, I had Mets all over me. And my medical oncologist there said, we're going to give you a break. I'm sorry, we're going to give you a medication that's going to take the brakes off your immune system. It was ipilimumab. He said, you're going to get an infusion every 3 weeks. And he said, don't worry, the side effects shouldn't be so terrible. And I said, what about losing my hair? He said, no, don't worry, you won't lose your hair. Well, that's the first thing that happened. I developed this folliculitis that looked like someone stepped on my head with a golf shoe. My hair fell out in handfuls. As it got wispy enough, I had our son buzz it off, which wasn't so bad. It's amazing what you can save in haircuts and shampoo. But then it came back snow white. And you folks are too far away, but my eyelashes and eyebrows are as white as well. And when I had no hair, I looked like Mr. Clean, which, for whatever. All was running smoothly. I continued to work. I borrowed a line out of the Shawshank Redemption where Morgan Freeman says, you can get busy living or you can get busy dying. And I figured I'm just going to keep on going. I continued to work. The one big bump in the road was when the lymph node on the back of my neck was so pronounced, I'd say it was bigger than a golf ball. And I think the fear was it was going to grow and move into my jugular and carotid artery area. So I received 5 doses of radiation. That was the worst. On that, it burned the inside of my mouth. For better for worse, I lost 20 pounds in 6 weeks, which was kind of neat, but I don't recommend that kind of weight loss. I wound up in the hospital for 4 days. They were giving me steroids. But then I came back and I just, again, continued to work. We are now fast forwarding until June 26th of 2013. I was driving down the New Jersey Turnpike. My wife calls me up and she goes, I just got a call from the doctor. They've seen your follow-up scans and all the tumors are gone. And I was in such a state of shock, I missed my exit. I just kept on going, but I did stop at a liquor store and get a bottle of champagne. And I'm happy to say that June 26th is now my new birthday. And it will be 4 years this June, next month. So my purpose on this planet, I don't think has been fulfilled. I'm not a religious man by any means. You know, if we go to a wedding, I wear a hard hat. I'm sure there's a loose brick up there with my name on it. But I just sort of, my epiphany was, I'm not in control of this. And I put my faith in modern science to pull me through this. So here I am. And that's basically my story. And she's laughing at me.